If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. All right, we are recording the Health Further podcast live from Nashville Healthcare Sessions, hosted at the Country Music Hall of Fame by the Nashville Healthcare Council. And I just got off stage doing a panel with Anna Hagui and Adam Bowler. We were talking about all things in the investing world, and fresh into the podcast box with, as always, Vic but also my very, 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 very dear friend and one of the most influential, powerful people in healthcare in the United States of America. He may not like that, but I think modern healthcare put him in that category, so I probably can point to them for the source. David Dill, who is the CEO of LifePoint Health. David.
Great. It is great to be with you. We're sitting here, and I'm looking out so many friendly faces, and it's good to see everybody all back together again. If I get distracted during some of this, it's because somebody's making a funny face at me outside of one of these windows here. But I'll try to maintain focus.
Yeah, we're in this fishbowl where everyone can see us, but they can't hear what we're saying, which is kind of cool and kind of distracting.
Let's talk about them.
Yeah.
David, well, first of all, just really quickly, I mean, your reaction to Nashville Healthcare Sessions this year. You've been involved on the board of the Healthcare Council for years now. You've been in this industry here in this city almost 2 decades, right? I mean, how does it feel to see this city start to actually convene one of the most important convenings for healthcare in the country annually now? And just the response and the electricity out there is fantastic.
Well, this is, as you mentioned, this is year 2 of this event. It's something at the Healthcare Council and our board have been talking about for several years. It's one thing to, bring in donations and contributions and membership fees and dues from member companies, and we deploy those resources by convening groups together. Well, as the community continued to grow, literally, we were building up reserves that we had to question ourselves. What do we do as a membership company? We had 2 options: one, dividend the money back out to the members, or if there's value in this, let's put the money to good use and make some investments in the city. And we felt Nashville was getting to the place that with infrastructure, with hotels, with flights coming in and out from all over, that the time was right. So about 3 years ago, we began planning what we now know as Healthcare Sessions. And as I look at even the name out there, it plays off of, and we may talk about this a little bit more as the discussion goes on, it plays off of this collaboration and music industry that really built Nashville into what it is. And Marcus, you and I have talked about this. I think collaboration is one of the things that makes Nashville pretty unique. And I give the musicians a lot of credit for that. And as healthcare continues to grow and evolve, we want to make sure that collaboration continues to happen. It's the only way that we're going to be successful to really create something that's lasting and meaningful. So Sessions is a play on that. And last year to watch it all come together, and now this is year 2, and we'll continue to build off of this. So it's really exciting to see investments that we've made along with the city to bring a couple thousand people together in a place that people want to come to anyway. It's not that hard of a sell versus flying all the way out to the West Coast or up to New York City or Boston up in the Northeast. Come to Nashville and you can see a lot of different things. That was 1. And 2, Nashville was really evolving in the healthcare community from a provider-centric, largely a provider-centric, piece of the economy and part of the sector, to now with technology. And you guys are great examples of that. And there's so many more. And now we have Oracle and we have Amazon. And so Nashville is changing, and we need to evolve and change with it. And that was really what led us to this investment. And to watch it come to life and sit here and see all these people walking back and forth, it's really exciting.
Well, we're thrilled to be here and to be able to record this podcast live with all the energy going on around us. But just to segue off of your last point about how Nashville has changed in terms of our healthcare industry, it really has evolved rapidly over the last decade, right? From this heavy provider-centric industry into a pretty diverse industry. Obviously, you had all of the cottage folks that were consultants and things like that were sort of staffing, that were surrounding. But really, over the last 10 years, we've seen data technology make a really big move into this city, and also even at least offshoots of the payer ecosystem are starting to be here as well, right? Can you talk about how that is reflected in the partnerships that are now possible to happen, right? Over the course of the last 25 years, technology has pretty radically changed the way that healthcare is delivered, paid for, and even the access that patients have to their own healthcare information. Technology has been a massive advancing force in that. It also is changing the way that organizations can work together. From the perspective of someone who has worked on the health system side for quite some time, how have you seen technology change the way that partnerships can be structured, are structured, and how does it make them better?
Yeah, well, there's a lot that's in there. And maybe we break it down into what I'll call economic partnerships, where you have kind of shared interest, shared ownership, and some non-economic partnerships. And we have examples of both. I'm sure both of you have some great examples of both as well. But you're right. If you go back, 15 years ago or so, I think about the makeup even of our board at the Healthcare Council and the membership of the Healthcare Council. It looked a lot different than it looks today. And I just finished a meeting a few hours ago upstairs. And when I look around that table, we would not have had all those voices around that table 15 years ago. And it is really a result of the recognition that healthcare is evolving and healthcare is changing, and technology plays a big role in that. And so we have adopted that at our company, getting better control and having better control of our data to share, to make better decisions, to have more viable partnerships with others that we can all be successful. So that has really been at the crux of investments and decisions that we've made as a company to invest, whether it's in, just block and tackle electronic health records, which was the first phase of this. We have a big partnership with an organization that's helping to kind of sit over the top of all of our different pieces of technology to bring real decision-making capabilities to our people on the front line. Not just a fancy dashboard for David to look at or for our CFO to look at, but for our operators at the unit level to look at on a day-to-day basis, a minute-to-minute basis, to make better clinical decisions. And we're just really scratching the surface of it. The balance of it is there's an insatiable amount of technology that's out there, and we can only adopt and pay for a certain amount of it. So picking and choosing our spots is probably the biggest challenge that we have. It's not because we've run out of opportunities, I can assure you that, but there's only so many things that we can get done.
Yeah, I mean, what I wanted to touch on is there's an opportunity, I think, to empower your caregivers at all different licensure levels to deliver better care, be more efficient, and also get better fulfillment, enjoy their job more. And so maybe is that one of the metrics that you're looking at as you think about where should we spend time and energy in technology? Yeah. Is can we empower our people? Because really the people at Life.
Yeah. So Vic, we developed with Duke. So if I rewind 15 years ago for us, we developed a partnership with Duke University. And it was really designed to go out and acquire hospitals in and around North Carolina. But it was this notion that if we combine a disciplined operator of community hospitals with the brand and a reputation of Duke, could we build something that 1 + 1 was more than 2? And as we developed that partnership and we started being invited to go to communities all through North Carolina, it was incredible the reception that was there. The understanding of we can get a Duke brand, but somebody that knows how to operate community hospitals. And we were proving out this thesis of 1 + 1 could equal more than 2. And while we were doing that, and we were very successful and acquired about probably 10 or 12 hospitals over maybe a 7 or 8 year period, all the way up through probably 16, 17 was the last hospital that the partnership purchased and partnered with. We developed a national quality program. And we developed a national quality program with Duke that we could spread out to all of our hospitals. My fear was, as the operator of the company, that we would have this separate track of quality if you were a Duke-related hospital or affiliated hospital, but our other 50 hospitals over time could get left behind. And what I was looking for was I need a program that served as the railroad ties that bound the track together. So no matter where healthcare moved, whether you were in North Carolina or in the other states that we operate in, that we were going to have the identical program, and that national quality program were the railroad ties that ensured they stayed parallel.
Well, the
all the way.
vision that you brought to it is to take that really thought leadership, incredible combination in North Carolina, and then bring it to the rest of the company. So you lift everybody up.
You lift everybody up. And where I was going with the main tenets, the three main tenets that we sat around board tables and talked about for a national quality program was about empowering leadership. This isn't, quality is not just the CNO's job or the chief medical officer's job. We expect in our company, every one of our CEOs to stand up in front of a room and explain what's going on with their clinical outcomes, clinical results, and what they're doing to drive them forward. So empowering leadership and setting expectations is number one. Number two is proven methods of performance improvement. So I was in here around the hall here earlier today talking to some representatives from one of the partners that we work with about the research that they've done and how do we take their research that's proven, that's documented, and then we're the only ones that can go adopt it, and then we adopt it. So proven methods of continuous improvement. As much as I would like to say we can implement this, we hit the switch, it's in, we're done. It's this journey that we're all on. And then finally creating an enterprise-wide, company-wide, but also a system-wide and a hospital-wide commitment to safety in the community. So a culture of safety, proven methods of performance improvement, but it all starts with leadership and empowering leadership at every level to drive us forward. And that's been exciting to watch. It's been very exciting to watch our CEOs of our hospitals. Some naturally are pretty gifted at being able to get in front of a crowd and talk about their quality results. Some aren't very good at all. And to watch how that whole curve has shifted as the expectations were set and we get them in an uncomfortable spot, force them to own it. Yeah. And now we have a group of leaders. They're not all alike.
Like a positive peer pressure where they pull it.
There is. Yeah. And I can tell you 15 years ago, if we were at a meeting and we said, we're going to talk about quality, the CEO would have stood up just like a good leader and said, we're going to talk about strategy and then quality. When we get to it, I'm going to introduce you to my CNO and let him or her do that. Now our CEO has to do that. And I think that's been a big cultural shift. And that partnership with Duke, part of that was kind of a non-economic partnership. We developed that with Duke, but it really started out of that economic partnership with Duke to go out and make a difference in the state of North Carolina. And while we're on North Carolina, I think it'd be it doesn't feel right for me to not mention everything that's going on in Western North Carolina. And we may not get another chance to talk about that, but I'll be over there later on this week. Just the devastation. So thoughts and prayers are with the people in Western North Carolina. It is tough. The pictures are hard. The reality's hard. But when you watch team members come together, kind of in your greatest time of need, sometimes you see the greatness. And it's been so inspiring for me over the last 6 or 7 days to watch team members taking care of team members. And then we do what little we can do to help bring additional resources into the community. So a shout out to that part of the country. And now we have another storm barreling down in Florida.
Yeah.
These are tough times, but this is what we do in healthcare.
Yeah, absolutely. My prayer is that for these parts of our country that have been devastated is that they have the kind of triumphant return that we had in Nashville. You know, I never wanted to live through the 2010 flood, but I do believe that this city took a turn after that because we saw how we could all come together and take care of each other, right? And so that's my prayer is that in these very, very dark times, these communities just see just how strong they are.
Yeah, and it's just amazing when some of the pictures and the stories that I've heard from our team. And leading into the storm, we positioned some resources and support in a certain place where we thought they were going to be needed the most, only to find out by Friday afternoon that we had the right resources, they just weren't in the right place. And then to relocate those resources became a problem because roads and bridges. And so the patience that our teams on the ground had as we went through this, but whether it's fuel trucks or water trucks or partnering with Second Harvest Food Bank, we've sent trucks over of food. All those little things really prove to me why partnerships are just so important. You cannot do this on your own. You have to have people that can come alongside, and LifePoint's blessed to have a lot of those partners.
That's a great segue because you just talked about a non-economic partnership that you ended up leveraging into national level improvements across your entire network. But then we just zoomed right back into something that was happening locally, right? You have the benefit of being this really, really strong national network where you can get the peer pressure and you can get the standards and all of that kind of stuff, operating leverage. That's great. But at the end of the day, each one of these hospitals inside of their community is seen as something important to that community. Hospitals are these kind of weird things where they serve a purpose, but the members of the community see them as something more than just a place where you go get healthcare, right? Oftentimes they end up sponsoring, little league teams, or they end up being important philanthropic, providers in those communities, et cetera, et cetera. I think people look at their hospitals as important cornerstones of their community. They employ a lot of people in the communities. And so I think many times as people who are trying to focus on innovation in healthcare, we see a lot of things around the development of the determinants of health and things like that. And health systems get charged with improving the overall well-being of their communities far beyond what their standard remit would really be, far beyond, hey, this is a service I provide, this is reimbursable. And what you just talked about, showing up in a moment like this in partnership with, different, Second Harvest and things of that nature. Can you talk about those local partnerships and maybe how LifePoint is able to provide an infrastructure that can standardize them, but still the local teams have to partner with organizations in that community, and they will be different than the next community that a LifePoint hospital resides in. And how are those partnerships structured such that LifePoint can do its best to deliver on that promise that the community sort of believes is there?
Yeah. There's a lot of thoughts that go through my head when you were speaking, and if I reflect back on, sometimes I wonder, why am I at LifePoint doing what I'm doing? I'm an accountant by training. I got into healthcare 30 years ago. Came to LifePoint 17 years ago, and what drew me to LifePoint was this notion of providing care in communities that don't have the resources that a city like we're sitting in right now has. And I grew up in a small town in Western Kentucky. My favorite place in the world, I've traveled all over the world, is to go home and be with my mom. That's home for me, and it's really what reminds me of our company each and every day. And so the mission of our company has been for almost all of our company's history, which we've been around since 1999, so a little over a quarter of a century at this point, has been making communities healthier. And I like that mission statement, first of all, because it's short and it's easy to remember and write out, but it's infinitely complicated, because making communities healthier is not just taking care of people when they come to the emergency department or to the clinic or wherever it is that they need to be kind of caught and taken care of and then move to the right setting of care. But it means that we're an economic engine in these communities. We are more than just a healthcare company. We're making communities healthier. We're the largest employer. We're recruiting the most high-paid talent that comes into these communities with oncologists and orthopedic surgeons and cardiologists. We're a big taxpayer as an investor-owned company. So we're an economic engine of these communities. And so what that means is when times of need, to much is given, much is expected, right? And so we have to lean in and be there. And there are some things that we can do at a national level, but those local partnerships, whether it's with EMS, whether it's with local food banks, whether it's with the local community college from a recruiting standpoint, all those little local partnerships are vitally important. We choose at LifePoint at the national level to only get involved in a couple of things that directly reflect the mission of who we are. And our two big partners here are Second Harvest Food Bank and Special Olympics. Those are two big national partners. But to some extent, those partnerships really don't matter in Price, Utah, when a crisis happens. What matters is they have a relationship and a partnership. So I think about it as we're basically just modeling up here what's important for them to develop on their own. So in their greatest time of need, yes, Second Harvest can help us and we can have a lot of resources go, but the resources that are available in the community, it's important that that partnership has that hospital has those partnerships intact. And our hospitals do a great job of that because, to your point, these are the biggest businesses in the community. Everybody understands how important the hospital is. Are we perfect every day? No. But most of our communities understand what we stand for, and that is to make every one of our hospitals the best and most that they can be.
You talked about being investor owned. When I met you, LifePoint was publicly traded company. And then, Bill Carpenter retired and you stepped into the role of CEO, and kind of almost right as that was happening, Apollo purchased LifePoint, and the company was no longer a publicly held company. And so, I remember sometimes we'd have breakfast and you talk about what it was like to be a public company, manager and officer. But since then, it seems like you've just had a lot of just a lot of joy in doing your job.
Yeah.
You haven't mentioned kind of, board meetings or investor calls or anything like that. You never kind of talk about that at all, right? And I was just sort of wondering, we're investors at a much smaller scale, but I know the relationships we have with the founders we invest in and the management teams we support, and when we sit on those boards, it's real. We are shoulder to shoulder with them. We're rolling up our sleeves. Sometimes it's great, and sometimes it's some of the hardest things these people will ever have to do. And I think a lot of people just think about investors as writing checks and that's kind of it. And they're just kind of, money grabbing people or whatever. But if you really want things to work out well, there is an importance of the culture in the relationship between investors and management teams. Can you talk a little bit about, sort of maybe just say a very small amount about the change from being publicly traded to privately held, and then what's it been like, working with Apollo, one of sort of America's great investment firms?
Yeah. So LifePoint's been around for 25 years. I've been lucky enough to be part of the company for the last 17 of those years. I've seen the company from the seat of the CFO of the company, the chief operating officer of the company, now the CEO of the company. And I've only ever worked in healthcare in a for-profit environment and a public company environment until November of 2018 when we took this company private. Up until then, my previous, whatever that is, 18 years plus was all around, actually more than that, 22 years. Was all around being a public company. So all the pomp and circumstance that comes with that, the investor meetings and the road shows and the raising of equity and board meetings and annual meetings, that was just kind of built into the DNA. And I kind of thought that's how everybody operates. Well, until I met people like you. And that's not how everybody operates. And I've told our team at Apollo, we sat down in 18 when they were contemplating making an investment. And I had the opportunity, and I'll have dinner with one of the gentlemen tonight, about the things that were important to this company. Bill and I both did. And that this is a company that is mission driven. It's a company that has purpose and meaning to it. And that's who we are. And I want to make sure that we not only don't lose that, but we make it even better as we grow. And so we embarked on a journey with Apollo in 18, and boy, a lot has happened since then. And you think about what we've been through with COVID, kind of repairing from COVID, all the inflation that's impacted all of your companies and our company and the whole, everybody in the economy. But they've been just such a steady hand through it all. And I tell them all the time, like, I'd like to never be a public company again. I love being a private company, not because it's easier. It's not any easier, but there's one person or two people that I can call and we can make a decision. And a real live example of where that played out, when I think about how our company has grown and evolved over the last 5 or 6 years with Apollo, we were only an acute care hospital company in smaller communities around the country. We're the only hospital in almost every one of our communities. And coming out of COVID, we made a strategic decision with our owner to diversify the business. And today we have the second largest rehabilitation platform in the country behind Encompass down in Birmingham. We have a growing behavioral platform that we never had. And we've had to, from a change management standpoint, kind of explain that evolution to the company. And some got it, some didn't. We still work on it every day. But those are investments that we probably wouldn't have made as a public company, because our public company shareholders would have thought, if I want to go own a rehab company, I can go buy Encompass's stock. Like, why do you want to do that? But those are examples of, I think, the seats that you get to sit in, no matter how big or small the investment is, you have a chance to not only, help make companies more durable, but also be an incredible mentor and champion for your management teams that are doing great work. And yeah, you have to make hard calls every once in a while with them and coach them, and maybe some discipline along the way. But the influence that you can have is profound, and don't miss that opportunity. And I appreciate all the owners that are out there, but our owners are not just write a check and hands off the wheel. They are very involved with us day to day. They're very thoughtful. They understand our business. We've tried to educate them, and I told them from the very beginning, my goal in this period of time with Apollo, I don't know how long it's going to be, is I want this to be the case example of the best way that Apollo can work with the management team. And I tell our members of our management team that every day, that we're going to be transparent. We're going to be open. If we get frustrated, we're going to be frustrated with ourselves. When we need to push back, we're going to push back. But we're going to be a great partner, because partnerships are important. And that's another great example of why partnerships work to make things better.
David, it strikes me that one of the advantages of moving to a privately backed investor-owned company is you have the ability to think in longer terms, right? Like, you could invest today and it may not pay off in the next quarter, as long as it pays off in the future. And as you were listing off some of the things you've been focused on, rehabilitation, adding capacity there, behavioral health. Last year you talked with Palantir, a lot of IT. You're really leaning into some of the biggest challenges as a healthcare system that we have: behavioral health in rural communities, rehabilitation where we don't have enough facilities. And how do you think about like where you can make an impact in the near term, in 90 days or 180 days, and also where the company is going to be in the future?
Yeah. So, one of the things that I missed when I first started this journey with Apollo, and moving and pivoting from a public company to a private company, and I just completely underestimated it. And it's so obvious to you and so many of your listeners, I'm sure. But what I missed was the real value of the investments that we're making on how do we make this company more valuable for the next owner. Apollo's mindset of there will be a next owner of this company. And we talk about that all the time. And there are a handful of investments that we have made, and they're not insignificant investments that we have made with Apollo that will not pay off in the economic sense over the horizon of their investment, but it will make the company more durable and more valuable for the next owner. That maybe the next owner will pay a piece of that.
Yeah.
I don't know how all that stuff will work, but I really underappreciated the important distinction of, yes, returns today are important, but making the right investments that make the company better over the long haul is something I completely underappreciated, and I have appreciated with Apollo on the back end of it.
Yeah, it's really a mindset thing. And then you attract team members that think like that. And I mean, you started in the finance department. There's certainly things you can do to increase earnings per share right now that don't necessarily build future value. Yeah. And when you're private equity backed, you have that kind of luxury. You have a significant owner that you need to do right by, but they're thinking about the longer game and where's LifePoint going to be in this healthcare ecosystem for the next 20 years.
Yeah. Well, think about for us, just real quick. I won't belabor this too much, but it's a company that's grown. It's a company that's diversified. We have assets in a lot of different states that have been acquired from a lot of different people. And Apollo had been in this investment for, the better part of probably 4 years, 18 to 22. We decided what we really needed to have more control of our business, to create some efficiencies long term and more stability and decision-making kind of insights. We needed to embark on an enterprise-wide resource plan. And we're deploying a big piece of technology now, and it's been a very expensive piece of technology, a lot of consultants around. We probably won't even implement it until 25 or early 26. So think about that. That's 8 years after the initial investment. And it was a discussion that I actually was thinking, how will they think about this? And it was, if it's right for the business, David, we need to do it. because it's what's going to set you and this company up for the next decade and the decade after that. Exactly, Vic, to your point. And those are just great examples of things that I would have missed, because in my previous mindset, I would have thought the answer would have been, no, we're not doing that. We'll let the next owner do that. We'll let the public company do that if you're a public company again. But it was, if it's right for the business, we'll be thoughtful about it. It's not easy, but if it will be thoughtful about it, and we'll make that investment.
Yeah, and I think it's an important point to touch on, because we're seeing the other side of private equity in healthcare with Cerberus and Steward. And of course, there are bad actors in every market, but Apollo and LifePoint, I think, is really a case study where it can work really well for the owners, for the employees, but also for the patients on the ground.
Yeah, and it's largely because they have taken an interest in understanding our company and what's important. And if they didn't care about that, some of these discussions would have been a little bit different. I probably wouldn't be still here,
Right.
Because it's just too important to me. But that relationship that we built with them, but it was based on, they really wanted to understand what was important to us. And we've had to make some changes, and we've tightened things up, and we've turned over management teams.
Yeah,
and
sure.
so we've made hard decisions. It's not like we're just stay out of our way and let us go.
Right.
I think this has been the greatest phase of our company's existence over 25 years, have been in these last 4 years, and it's been a joy to be in the middle of it.
Two comments before I move to our last question. The first is, I'm just really happy for you as an operator, that you got to have this experience, and not have only ever worked in publicly traded companies. I'm glad you got to have a true capital partner that let you do some long-term important things that were important to the mission. And just sort of part two of the comment is that I remember when LifePoint Healthcare became LifePoint Health. Am I remembering that correctly?
Hospitals became LifePoint Health.
Became LifePoint Health. And I remember we had this conversation. And at that time, there were a bunch of different businesses that were doing this. And quite frankly, it felt like a branding thing.
Yeah.
And I think what's so fantastic is that through this Apollo acquisition, and the relationship that you and them were able to build, is that you were able to make good on that brand change, right? You're not LifePoint Hospitals anymore.
Yeah.
The rehabilitation business, the behavioral health business, that diversification is a reflection of a true commitment to making communities healthier. And I'll just tell you from the perspective of an investor, we only support our management teams in doing that if they're executing well. Like if they're not getting the basics done, they don't get to do that. You know what I mean? And so I would assume that Apollo, you never promised when you changed to LifePoint Health you were going to keep the management team. You know what I mean?
Yeah.
You're focused on the communities you're serving, and so sometimes changes need to happen throughout that process, and every investor understands that. But I think the ability to diversify the business into what everybody understands is a much more complete picture of what it means to be healthy, right? Not just what happens when you're inpatient, what happens when you're post-acute, what happens, on your day-to-day when you're just trying to live your life in this very stressful world, right? All of these things now being part of what LifePoint can offer its communities is a pretty big deal. So I
appreciate that. I appreciate that. I get notes and emails from people all around the country, and some of them are, here's where we're falling short. That's good. We can take that. We can learn from it. Makes us better. I hear great stories about things that are going well, but with a nurse at the bedside. I've never, David, received this kind of care, like nurse fill in the blank, whoever it is. And those are just heartwarming, stories to hear. But what's really important to me is that we have stayed, true to our mission and true to who we are. And as long as we keep doing that, focused on quality, this notion of tax paying versus non-tax paying, I like think of it, or for profit, not for profit, it's tax paying, non-tax paying, and we're all doing the same thing. When we're out acquiring and looking at hospitals to partner with, we take our mission statement, their mission statement, put them together, and it's amazing how consistent they are. So there's so many similarities of what we're all trying to do, and that's we're going to stay committed to that. As long as we stay focused on quality, the rest will follow. Financial results will be there, and that's what galvanizes the team. So, but I appreciate the thoughtful comment.
Final question.
Yeah.
We gotta get you out of here, man. You're a busy man.
That's okay.
And this is also part of the Apollo discussion. 25M Health, right? So one of the things that maybe I necessarily didn't see coming was that you all would make an official, branded, dedicated step into the venture world, right? And I'll leave it to you to actually explain it so I don't butcher it at all. But whenever an organization does that in a branded way, not like an internal initiative, but like you're actually coming to the public and saying, hey, this is something we're doing. Here are our people you should talk to, et cetera, et cetera. That creates interest and excitement, quite frankly, in the venture world. Vic's fund has already done a deal.
Gracia, we do.
Yep.
We do.
Yep.
Yeah, and
we'll have Meryl and Sean on another podcast tomorrow.
Oh, great.
Yes.
Great.
yeah. So maybe just talk a little bit about that experience as well, right? I mean, you didn't have a ton of experience in the venture world, and now
Still don't.
yeah, well, you got more now than you did 4 years ago, right?
For sure.
But just talk about, what is it like to have taken this step into this world, and what have you learned about it, and how have you maybe seen opportunities for LifePoint to evolve in a way that it can optimally interface with the venture world,
Yeah.
right? Because we know we're weirdos out here with our $1 million deals here and there. You're playing in B's, we're playing in M's. We get that part, but also, I mean, I think we have the same sort of aspirations, right, to make the American healthcare system better and to help communities in our own way. So I'm interested in your thoughts on this journey, like. What have you learned, and what are you hopeful for?
Yeah, so there's so many. We talked earlier about we're not out of ideas and opportunities to improve healthcare. So there's tons of opportunities. One of the things I've enjoyed most about it is watching young entrepreneurs live out a mission and a desire, and to watch them, to see the excitement, to keep me young in a weird way, like to keep me young and on my front foot on what really is possible. I don't want our company to be just that you're that old line hospital company that's just hard to work with. That's not who I want us to be. And I know we can be that way sometimes. And we have, lawyers and business people that are looking at everything. But when we were looking at a lot of different opportunities with other companies, and we engaged some to help us, and watching those companies become successful, we really looked at it and said, we've got an opportunity to do some of this ourselves. But it's not in the DNA of our company. And we need a partner. We need somebody that we can invest with, keep it separate from us so it doesn't get kind of clogged up in this big machine, but keep it separate. Let that organization bring ideas to us. But the best ideas that have come were from people that have traveled out to our hospitals to listen to our people about where the real pain points are, and then create a solution to solve for those. So Gracia is a good example of that. There's several other good examples. But we also know that we can't implement everything, but we have to pick and choose our spots. But when we have a young entrepreneur that has an idea, that's listened to where the problem is, has proven out the investment thesis, then we have the opportunity to build something. Will it move the needle overall on the investment for Apollo? Probably not. But it's really kept our company on our front foot. That's what I've learned more than anything else. And when I travel around and I hear our CEOs talk about, we had Meryl out in our hospital with his team, and they're helping us with this. And it is so cool, David, what they're going to do and how they can take something that used to take us this long to this long. Those little things stack up, and they're meaningful. And then once we develop those and prove it, then we can commercialize it. And but the learnings for our company have probably been the most valuable part of the whole experience.
Yeah, I mean, that's great to hear. I think the scale that LifePoint operates on, you're saying these notes from, good and bad notes from the field, it's everyone's most important thing in their life when their mother is in a hospital room and that nurse is coming in and seeing, 10, 15 patients all shift. And he or she has to care for that family really well. That scale is incredible. And your ability to not compromise that, but create the studio where entrepreneurs could come learn from the people on the ground working and then try new things and bring some to market that seem to work is just an incredible benefit for, I think, your system, but also for me as an investor and for the whole entrepreneurial space to learn this.
Well, and it's not just taking care of a family. It's in our communities. It's what brought me to the company years ago. It's taking care of their neighbor. literally their neighbor. You know, my son-in-law is a nurse here in Nashville, and he's taking care of people every day. He's doing it the best he can, but he doesn't really know these people. They're more than a number, for sure. That sounds way too like they're more than a number, but it's a person.
Yeah.
But
in rural America, it's not like that.
When you get into these communities, when you get into the devastation of Western North Carolina, these are people that are taking care of their Sunday school teacher or their school teacher of their kids. And so, yes, it's taking care of family, but it's taking care of your neighbor. It's taking care of somebody that's important to you. And I think that's what not only makes the company unique, it's what motivates me to make these stronger, more durable, and better from a quality standpoint than they could be on their own. And that's really exciting. And part of it's just because of where I grew up.
Yeah, but your wisdom to say, we don't want to throw stand into that gear where we're taking care of these thousands of people every day. Let's create a dedicated studio where we can have them come in and teach us what the problems are. I think that was really, like, a lot of companies will just try to do it ad hoc, and that's challenging because you have to do things at a high quality at significant scale.
Yeah. Well, I'm really proud of what we've done, but I'm also not so removed from it that it's not perfect. And it all can sound good around this table, but we work hard every day, and we mean it, and we do it with a purpose. And we will continue to work to get better each and every day to fulfill that promise that we made to these communities.
No better way to end than that. David Dill, thank you very much.
Thanks, Marcus. Thanks, Vic.
David.
Appreciate you.